Hello, this is Dr. David Green, CEO of the Texas Pain Network. The topic today is the non-operative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to degeneration. It's not simply a two-dimensional problem. There's also rotation involved, so it is a three-dimensional problem. It's very different than pediatric scoliosis. Pediatric scoliosis is typically not painful. Adult is. Adult scoliosis is stiff, so because patients are skeletally mature and their spines are not as flexible like they are as a kid. In adults, the scoliosis often leads to back pain and leg pain. Adult scoliosis occurs because of two potential reasons. One is if you had pediatric scoliosis, you became skeletally mature with a curve that was over 40 degrees. Studies show that it will often get worse at an average rate of 1 degree per year. Doesn't sound like a lot, but if you're 20 and then 50 years later, you 1 degree per year, that's 50 degrees plus 40 that you had as a kid, that's 90 degrees. That can really add up. Another reason is it can occur new secondary to spinal degeneration. So the cascade of events is that you get degeneration in the disc. This leads to abnormal motion in the facet joints in the back of the spine. Arthritis occurs that's usually asymmetric. And then you start to get scoliosis and pinched nerves. So the symptoms is that the arthritis from that facet degeneration leads to significant back pain. You can also get muscle aching and weakness from difficulty standing up straight. Once you get to a certain point, you can be really off kilter to the right or to the left or forward. It can be tough to see the world straight. You can also get buttock and leg pain from spinal stenosis where nerves are getting pinched. Here's a curve here. This would be the convex side of the curve. This would be the concave side. You see how the nerve roots are coming out here, here, here. See how there's less room for them to get out as opposed to these areas? So the person, this is left, this is right, so this person would most likely have some right leg or buttock pain. There are many treatments for adult scoliosis. The most simple is over-the-counter medications such as anti-inflammatories, Tylenol. Prescription medications may include higher strength anti-inflammatories, neuropathic medications such as Neurontin and Lyrica, narcotic medications for when the pain is bad, and then topical. This can be either a pain patch or a prescription pain cream. Physical therapy can be very beneficial along with interventional treatments. This may include a facet injection, so you have a needle going right into the arthritic joint and providing steroid medication just like you would have with a degenerative hip or a knee. This steroid may stick around for weeks to months and help with pain relief. Trigger point injections go superficially just below the skin. They can help relieve muscle aches and spasms. Here are a couple of great procedures. The top shows a medial branch block. This is where the pain doctor will place numbing medicine around the affected joint or joints, depending on where the arthritis is. And these little nerve endings, called medial branches, supply sensation to the joint. The numbing medicine and possibly some steroid can help relieve that pain for up to an average of 3 months. Now, when it wears off, it can either be repeated or this procedure can be performed, which is called a radiofrequency ablation. This puts the needle in the same place, but it actually heats up and deadens these medial branches and can provide relief for 18 months. Epidural injections work well for the pinched nerve aspect of adult scoliosis. For instance, when you have spinal stenosis, it can really help a lot with the buttock and leg pain. Non-operative treatment provides over 90% of those with adult scoliosis a satisfactory level of baseline pain. Between the treatments for the back and the leg pain, most patients do not end up needing surgery. Surgery is an elective quality-of-life procedure. It should be a last resort because the complication rates are over 50%. Adults simply do not tolerate scoliosis procedures like adolescents do, and the procedures typically have to be much more extensive because the spines are not flexible. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state, accepting over 50 insurances and over 25 treatment options being provided, with average success rates over 90% at pain relief and helping people avoid surgery. The board-certified award-winning doctors provide both medication management and interventional treatments. Visit us online today at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.